Welcome to Compassionate Conversations. The goal of our podcast is to explore topics related to serious illness. Ancora Compassionate Care exists to be a supportive presence for life's journey. We can provide care and support wherever a patient may be on their journey with a serious illness. Ancora Compassionate Care began as Hospice of Rockingham County in 1987. While our name changed in late 2023, we are still the local provider the community has always known. We'll always be there because we've always been here. Welcome to this edition of Compassionate Conversations. I'm Lynn Flanagan, the CEO at Ancora Compassionate Care. Megan Cole, who is the Director of Counseling Services, is joining me today. Thank you so much for being here.
Thanks for having me.
So, this is new. We talk about Ancora Compassionate Care, obviously started in 1987 as Hospice of Rockingham County. Fast forward several years, and we were doing more than hospice, so we rebranded in name only, right, to Ancora Compassionate Care. But what inspired the establishment of a counseling center?
You know, it kind of came from a variety of paths. One path was recognizing that some of the folks on our serious illness care program needed behavioral health care. You know, they needed someone to talk to, and our nurse practitioners needed someone to help them have some of those conversations. Yeah. So we started there, and then also, I guess, kind of simultaneously, we were noticing our bereavement program was booming, not so much, or not entirely just our former hospice patients, family members, but people in the community who were calling and saying, I'm grieving, I'm having a hard time, I need someone to talk to. And we, you know, our grief counseling team are wonderful, and they would meet with folks for free for a few sessions, but we were consistently feeling like folks needed more. You know, maybe they were grieving, but they had a lot of trauma, a lot of depression, a lot of anxiety that they were coping with. And after our handful of free sessions were finished, we didn't really have a lot of places to send them for continued care. So, you know, you and I started talking, and here we are a little over a year later, growing like crazy.
It really is. So when I think about the two of us, you mentioned the bereavement team, and also just a little history. We grew up in hospice, right? So when and my background is a nurse, you're a social worker, but when you think about, this was not such a big leap because we are very used to thinking about holistic care.
Right.
And so with our hospice service line, of course, we're very used to taking care of that whole person, but what we mean by that is we care for them physically, we provide emotional support and spiritual support. So I feel like our organization has always been very in touch with the community. And so spinning off and opening this counseling center really is because we listen, we recognize there is such a need, like you were saying. Yeah.
Well, and you think about our mission, right? To be a supportive presence on life's journey. That journey doesn't just mean the final years to months of life. That journey means my kiddo's going to college and I have an empty nest, or my marriage is struggling and I need someone to talk to, or I'm having some really hard times processing things that happened to me when I was a child, and I'm not sure where to put these feelings and these memories. So if anything, I feel like the growth of the counseling center is helping us only further that mission.
Absolutely.
You know?
And I love how you tied that in. So as our organization grows, no matter what service line we're talking about, that same mission does carry through
Absolutely.
all the way. So even though we have the same mission, how do you view this counseling center, though, serving the community? What's the overall benefit?
Well, one benefit is the fact that folks are not having to wait months and months for sessions in Greensboro. You know, there are very few counseling centers that offer behavioral health services in Rockingham County. The ones that do, you know, we're hearing longer and longer waiting lists. the fact that, people even having to go to Greensboro or looking at appointments months down the road. Well, if you're really feeling depressed, really feeling anxious, really struggling, you don't call on August 12th and expect to wait until November to be seen.
Right.
You want to talk to someone soon. And, we really pride ourselves on trying to get folks in and seen within just a few weeks at the latest.
Yeah.
We really want folks to be able to see someone quickly. And we can offer in-person or virtual sessions, so people aren't having to drive, 30, 45 minutes to Greensboro or even further to Winston or Burlington. You can maybe come by on your lunch break or log on during, a free period in your afternoon. There's just a lot more flexibility when you have this service closer to home.
Absolutely. And so it's convenient on both fronts, right?
Mm-hmm.
So, and getting people in faster. I think about, fortunately it's in the rearview mirror, but not too long ago, I think we saw such an increase during the COVID years of anxiety and depression and
Absolutely.
lots of different types of support that people need. And so it's becoming a little more normalized, but I've always felt so strongly about chipping away at the stigma of taking care of your mental and emotional health. So do you see this counseling center helping in those ways too?
I do. And I've actually had people tell me, that this was the first time they'd ever sought counseling, and they were really nervous about it because they'd heard, that if you see a therapist, that means that you need to be on medication or you're going to be put in the hospital, or if you have children that we're going to somehow notify DSS that you need therapy to talk to someone. So being able to sit down with them and just have a conversation, and pretty much every initial session I do, I try to ask the person, what have you heard about therapy? What are you afraid of? And then I'll say, I want you to think about this as our first date. There are some first dates where at the end of it, you're like, man, I really like this person. I can't wait to talk to him again. And then there's some first dates where you're looking for a window to crawl out. I'm hoping that at the end of our first date, you're not looking for a window. But I also tell them, look, there's going to be times where it's not a good fit. I've had some therapists that I wanted to find a window to crawl out, myself. But there's also some where I felt like, man, this person really hears me and they understand.
Right.
And if I can't be that person, or Christy, the other provider, doesn't meet that need, then let us help you find someone who is.
Well, I love that approach. Let's get the misconceptions or the misinformation out of the way. Let's address it head on, because, sometimes that is in families, or it goes from generation to generation, and they do have the misinformation that you just can't quite let go of.
Yeah.
But to help people understand that caring for yourself, your mental and emotional needs, it is no different than if you have COPD and you need to go to a pulmonologist. My mom's been a type 1 diabetic for 61 years, so she has an endocrinologist. This is the same thing.
It is.
And taking care of your mental health may actually help with your physical health.
Oh, absolutely.
Because it's going to come out one way or the other.
Yes.
So, and it's interesting you said if you're not a good fit. So I've had a therapist in the past that described the first one, that finding a good therapist, she told me, was like trying on clothes. Mm-hmm. And I kind of looked at this was via telehealth. She said, yep. She said, some it's going to be a great fit just like that. Some they're going to fit for a while, and then we got to try something new. She said, so you're never going to hurt my feelings.
Exactly.
So, and that I think brings a level of comfort for people to understand that if it's not a good fit, let's just find out right away.
Exactly.
And make a change.
Right.
Yeah.
And I do tell people, if I'm hearing you tell me what's going on and what your needs are, if I'm hearing that you probably need to talk to a substance abuse counselor, I am not a substance abuse counselor. Right. So we're going to talk about, before we go any further, I think this other provider may be a better fit for you, or I think we need to look for someone that specializes in this really specific treatment program that I don't. because I don't want to waste your time. I want to make sure
Right.
that you're getting what you need from this experience. And it just may not be me, and that's okay.
Right.
But I'm not throwing you out and saying,
Right.
good luck. We're going to
Yeah.
figure out what the next best step is to get you the help that you need and deserve.
So the support continues, even if we're looking
Absolutely.
at another spot. So you mentioned Christy. So let's talk a little bit about the providers that are here.
Mm-hmm.
You can tell a little bit about yourself, but just some backgrounds. Are there things that you guys specialize in? I think you complement each other very well, so I'd love for our listeners to hear that.
Yeah, so Christy and I actually have worked together several times. We are both graduates from UNC Chapel Hill with Masters in Social Work. We are licensed clinical social workers. We met working at Moses Cone Hospital around 2008. We were both pretty new grads at that point, and we have just stayed in touch and supervised and worked together all these years on and off. Christy has worked in private practice for the last few years. She's worked in school systems. She has a lot of experience, working with trauma, with teenagers, a little more experience than I have working with families or couples. My experience is more, from my hospice time and from personal experience, grief and loss, life transitions, infertility and adoption for me. And then, we both just do a lot of work with anxiety, depression, just stress, coping mechanisms,
Okay. So you mentioned children with Christy. So are there age ranges that we see at the counseling center?
The youngest that we see is typically kindergarten to first grade, all the way up. I've got some toys here. I don't know if you can see on the cameras, but we've got blocks and fidget toys. We are in the process of creating a kids' room that's going to be very kid-friendly to do, structured activities. We've got therapeutic games that we can play to try to make it fun, because a 5, 6, 7-year-old is not going to sit and tell me about their problems.
Right.
But if we bring out books and we bring out games, we can connect differently and start to process feelings, learn new ways of talking about and identifying how we're feeling and how to cope with those big feelings when they come up.
Okay. What would you tell somebody, let's say it's somebody that's not had therapy before, we've touched on that a little bit, but they think, maybe I should call, maybe I need some help. What would you tell them to expect from the first session? Everything from time-wise to...
Oh, that's a great question. The first session is typically going to be about 45 minutes of talking. The first session is the one where we talk the most, usually, because there are a lot of things we need to find out. If you're seeking therapy for the first time in your life, what was the catalyst? And sometimes that in itself is an iceberg, right? But we want to find out too who your support system is. Do you have enough money to make your basic needs get met each month? Are you experiencing domestic violence or abuse at home? What are the things that bring you joy? Do you have pets? Do you have kids? Do you have grandkids? So we're kind of trying to start to put your puzzle pieces together, and then we spend some time looking at your goals. 6 months from now, what are you hoping will look different than what it looks like today? They folks fill out paperwork before they come in. They fill out a depression screen, a anxiety screen, and then just a little short form basically asking what leads you to us today. So we go over those, and if there's symptoms of depression or anxiety that are really severe, we talk about how is that showing up in your life, especially if there's symptoms of depression that make us worry that they may have thoughts of suicide. We definitely spend time just making sure they're safe.
Sure, absolutely. And sometimes all of these symptoms show up in our workplace.
Absolutely.
Right? So I think sometimes if people have access to an employee assistance program, that may be the catalyst, right? To refer them to the counseling center.
Yes.
Yeah. And take another step forward.
Yeah.
Yeah. Okay. Well, let me ask this question. because everybody obviously is not the same. So when you're having these first sessions and you're learning more about this person, I'm assuming, but you know what that does, that you all have to figure out like what therapeutic modality is going to work best for this person or for me. So talk a little bit about that. How do you decide what modality you're going to use?
So most of us, in the therapeutic world have kind of our favorites in our pockets.
Right.
One of the big ones right now, of course, is cognitive behavioral therapy, which is basically as simple as the way we think influences our behaviors. And so therefore trying to change the way we think instead of thinking, oh my gosh, I'm going to fail this test. It's going to be terrible. Giving yourself that stopping point and going, I've studied really hard for this test and it's going to be what it's going to be. And if it's not a great day, we're going to try again, but just trying to work through that catastrophic thinking or other ways of thinking that just kind of put up those roadblocks. Christy and I both come from a very person-centered approach, meaning we're going to do what we feel like works for you. We don't do cookie cutter. Right. Everybody does this in the first session, this in the second. There's lots of different interventions from different therapeutic treatment models that we pull from. And if there's a specific intervention that we want to try, that may be considered a little more unusual or woo-woo, as you might say, we're going to talk about it. Are you comfortable trying this? This is what this might feel like. It may feel a little weird, but a lot of it is simply exploring why we talk to ourselves the way we do, really focusing in on self-compassion, giving ourselves the same grace that we try to give other people all the time.
Absolutely.
Because we're really not very good at that sometimes.
We are not. It's like our needs are always on the back burner, right?
Yeah. I mean, how many times do we hear here lately, self-care is not selfish,
Exactly.
And just really trying to help people embrace that and go, you know what, it's okay if I set this boundary and take care of myself for a little while.
Absolutely. You mentioned early on that it could be in person or it could be telehealth. So talk a little bit about the technology. Does that always include video? I'm making the assumption that it does.
It does. Okay. Now, if there's we've had power outages, we've had all kinds of things happen. Once in a while, we can make an exception and do a session just via phone. Okay. But for insurance purposes, we do need audio and video running so that we can see one another. And, you start to lose a lot when I can't see your face and you can't see mine. Right. And as you can tell, I talk with my hands. I need you to see what my hands are doing.
Exactly.
But no, we use a HIPAA compliant, it's like a healthcare licensed version of Zoom.
Gotcha.
So it is very secure. We manage sending out the links. We don't let other people into the room or anything like that. And I do try to make sure that the person is in a place where they have their privacy. Right. If you are in a session with me virtually and I see a shadow behind you that indicates someone's walking around, I'm just going to get real quiet and give you a minute to tell me how to proceed, right. And then, of course, here in in-person sessions at the counseling center, we have our private spaces. Sure. We are in one right now. We have noise-making, like white noise machines outside each door, and they work exceptionally well. You cannot hear a thing when we are in session with the door closed. So we take patient privacy very, very seriously.
And, that's part of psychological safety too.
Absolutely, right? It is.
And feel supported. So that's fantastic. So as we move forward, I'll ask you to visualize a little bit. What are we hoping? Do we want to partner maybe with school systems? Are there other businesses? What's on our wish list as far as goals? Everything.
I would love to see partnering more with the schools, to provide that support to children, but also to the faculty and staff in Rockingham County and the surrounding area. I would love to see us maybe be able to offer some support groups. I would love to see us grow and need to hire more providers, which I think is going to happen before maybe we're ready. But just as Ancora always has done, we see a need and we look around, and if nobody else is doing it, okay, then let's figure out how we can. And that's what is so exciting about being here and watching this growth over the past year.
Yeah.
Like we talked about earlier today, we saw 5 clients, I think, total in October, and 110 individual sessions in the month of July. Like,
that's
the
incredible.
sky's the limit, and it's just a really exciting time.
Yeah. Well, that's a perfect way to wrap this up, because you are right in that our organization does listen. And not only do we listen and we seek out what our community needs, we're so quick to want to jump in. What can we do as Ancora Compassionate Care? How are we going to help you meet this need? How are we going to support the community?
Right.
And that is always our goal.
Absolutely.
And it goes right back to the mission, right? To be a supportive presence
That's
for life's journey.
That's it.
So what's the best way for people to get in touch with you all?
You can reach out to make a referral for yourself or a loved one to the Counseling Center by calling the main office number.
Okay.
336-427-9022.
Okay.
Our intake team, we have a specialized intake team member. She is fantastic. She and her team are happy to help, process referrals, get your insurance verified. And like I said, we try to get everybody in within a couple of weeks, if at all possible, because we know you don't want to wait.
Sure. Yeah. Well, thank you so much for being here today and
thanks
sharing
for having
this
me. Thanks for coming to visit here at the Counseling Center.
Absolutely. Thank you for joining us for this edition of Compassionate Conversations. If you would like more information on any of our service lines, whether it be end-of-life care, serious illness care, or our counseling center, you can check out our website at www.ancoracc.org. Call our main number at 336-427-9022.